So I wanted to say at the outset what a lucky country it is that we're living in, to be considering such advanced relaxation of restrictions at the moment. Western Australia in particular, I think, is very lucky, and in large part because of our isolation and because our politicians have accepted that we need to keep this disease at a very low level, and they've followed excellent public health advice. We've had clashes along the way about the minor details, but overall we're very, very grateful for the response of the government and for our luck in our isolation. I want to make a couple of comments about the new cases in Perth this week as a result of the arrival of the live sheep carrier, and ask what lessons we've learnt about that. I think we've at the beginning of this process, the AMA was very concerned about multiple levels of government being involved, and this is an example of the kind of thing where wires get crossed, the proper process is not in place, and something as basic as the arrival of a ship, which we all know is a high risk, was not handled as well as it could have been. So hopefully those kind of processes have been sorted out. We also know that the quarantine hotels had problems at the start with their coverage for PPE, and we know that at least 2 hotel workers in Australia have been infected in that environment, thereby creating a risk for the community. So we're really hoping that those processes are now also sorted out. In terms of the announcement around the reopening, because we've been successful and we have low spread, this is a pretty serious advance that we're talking about next weekend. I feel a bit like we've strapped on the skis, we're at the top of the mountain and we've decided to let's go. So it is with some trepidation that we look forward to see what will happen over the next month as we get into the cooler weather, which favours respiratory viruses, and we have such widespread reopening. What we're really hoping is that the community understand the risk that we're all taking together and really take seriously those issues around hygiene and spacing and so on, and not think that this problem is in any way solved, because the virus is no different to what it was at the start. In that sense, the DETECT trial is a good start in terms of looking at asymptomatic workers in at-risk areas, and we again implore the government to allow us to do that kind of testing on patients who are coming into hospital for other reasons as well. I think that the comment that was made by the Chief Medical Officer today, that if we can keep stable epidemiology, small outbreaks and widespread testing, then this kind of easing of restrictions, hopefully we won't have to go back in the other direction. But if we do start to see any sort of sense of an uncontrolled outbreak, people will have to accept that gathering together just can't carry on. I would say one thing in conclusion. There's been a fair bit of press around the comments of the veterinarian on the live sheep carrier. This is the situation that keeps on giving in a news sense. I was completely on board with the veterinarian when he said that he really doesn't have much in the way of medical expertise, and whilst I'm very sure that he's very good at looking after sheep on the high seas, I think he should restrict his commentary to that, stay away from human medicine, virology, public health, and certainly there needs to be an investigation into any treatment that he was giving to the workers on the ship, because quite seriously I think they deserve better than that. Thank you.